Hello, hello. My name is Jill Osborne. This is our third stream for the day. Today is Friday, June 28th. It's been a very good streaming day, and so I thought I'd come back this evening and see if we could find any other patients who are struggling with their IC and pelvic pain. So this is a live IC support group meeting. We normally do two scheduled meetings a month. That's the first and third Sunday of the month at 12:30 Pacific time, 3:30 Eastern time. But I quite like doing drop-in meetings also because I like to play with time zones. The later we do it, then we're going to catch people in Australia and New Zealand and England and all sorts of stuff. Hello, Lindsay. It's nice to see you. So I thought I would come back and do a night stream, one of our rare night streams. Hello, YouTube. How are you today? Hi, Lisa. Hello there. All right. Let's see here. I gotta get this right. So, I know, man. Lisa. Lisa says, "Wow, you're a trooper today." I am, man. I am into it today. Today is a really good support group day, in my opinion. Hello, Gigi. Hi, Nancy. Nice to see you. Hi, Gigi, again. So I hope you guys are having as good a day as I am. I'm having a pretty good day now that I'm over I was feeling miserable 2 days ago with a lot of pain. So what did I do? I did a couple of really stupid things. Number one, I I used some mosquito repellent on my legs, and unfortunately, the chemicals just killed me. Wicked vulvodynia. Then I went and worked out without stretching and strained my piriformis muscle in my pelvic floor. And then just to make, matters all the more entertaining for hello, the mysteries of IC flares. I ate something right before I went to bed that was incredibly stupid, like a couple of grapefruit slices. And oh my God, was I ridiculous. But you know what? We're all different and we all make mistakes. And the cool thing is that we get to come together and share tips and share strategies and commiserate all that sort of good things. Gigi says, I think you talked about in your earlier stream that I wasn't a part of, but can you explain the correlation between fungal overgrowth and IC? My functional medicine doctor did a urine test. He found lots of fungus. Well, hon, that was our own National Institutes of Health who found fungus in the urine of IC patients. That was here, hold on a sec. That was the MAP Research Network, the multidisciplinary approach for the study of pelvic pain network. And several years ago, they released a study. I did a big article on it on our website, and we recycle that every now and then so people can see it. What very interestingly, they happened to find in the urine of IC patients having flares, often overgrowth of Candida. And of course, typical urine tests do not test for fungus. And so they were using next generation tests, and they did indeed find that many, if not most of their patients struggling with flares had Candida overgrowth. It's really fascinating. And the thing is we all kind of get drawn into the symptoms of frequency urgency pressure pain as being associated with bacterial infection. And we forget that fungal infection not only is possible, it is probable in this patient community who has had massive exposure to antibiotics. Now, of course, a typical urine test will not identify a fungal infection, but a next generation test will. A next generation test absolutely will identify if you have any fungal overgrowth. And it's important to know several years ago that when the Center for Disease Control issued their top 10 antibiotic resistance threats, 9 out of the 10 were bacteria, but one of them was actually Candida. And it turns out that drug resistant Candida, systemic drug resistant Candida, kills many, many patients throughout the year. It's very common in hospital settings as nosocomial infections. So fungal infections happen in the bladder, and fungal and also viral infections happen in the bladder, whether it be Epstein-Barr, polyoma BK, HPV, herpes. These are all, the virus is as vulnerable to infection as, any other part of their body. And I think I think one of the things that really concerns me um, right now is what we're seeing a lot of HPV driven cancers. And they're really heartbreaking. I was working with a young woman who's 34 who had urethral cancer driven by HPV. They had to take out her urethra, they had to take out her bladder, they had to take out, she had a complete hysterectomy. Thankfully, I think she'd had one or two children by then, and all potentially preventable with the HPV vaccine. So we got to be on top of the human papillomavirus. It's definitely a big, big deal. So what we're going to do tonight, so tonight, don't normally do nighttime streams, but I have some stuff that I want to share with you in terms of some new research. But even before we go there, I really want to talk about, and I need your help with IC Awareness Month. So every September, IC patients gather together to promote IC because, hello, who else is going to do it? It's going to be us. Nobody else is really doing it. It's just us. Pharmaceutical companies walked away from educating people about IC about 8 or 9 years ago, if not more. And so, and to give you a little bit of history, the first IC awareness activity was IC Awareness Day in November. It was created by the original ICA. There were two ICAs, ICA California, ICA East Coast. The actual original first IC association was established in California by a couple of patients of Dr. Lowell Parsons. They were the ones who kicked off IC awareness activities because they were very heavily invested in research. They wanted to promote research. So they had an IC Awareness Day in November, very close to Thanksgiving, I think. And then eventually that got transitioned over to October. And so for several, I've been doing this for 25 years. So I'm going to say for probably 10 years, IC awareness was in October. And of course, it got smashed by breast cancer awareness. You couldn't get a story in any media even if you prayed for it, because any available nonprofit awareness space in media was taken up by breast cancer awareness. So, what happened then is Ortho Urology, which is a company that, and Janssen Pharmaceutical, the companies responsible for Elmeron, they paid for a lot of it. I mean, we really, despite the problems with Elmeron, it is undeniable that we could never have gotten as far as we had without all their outreach and all their educational materials. They did amazing educational materials, of which one is that slide that I keep showing you guys. It's so cool. They had disagreements with the IC people at the time, not me. And they decided to back out of all things IC, and they shut down all of their IC awareness activities. So I waited a year. I was thinking that the ICA would pick it up, but they did not. And then finally, a year later, it's like, okay, if they're not going to pick it up, I'm going to pick it up. And so the Interstitial Cystitis Network took over IC awareness 8 or 9 years ago. And the first thing that we did is had a vote about when to have it, because October was just non-productive. And so we did a big national vote, internet vote, even here on Facebook and on our website, etc., and asked people when they would prefer to have IC Awareness Month. And they said September. And so we moved it to September. Then we decided to expand it from a week to a month because a week wasn't enough. And my goal with IC Awareness Month is to, I don't think that IC awareness should be about promoting an organization. I don't think it should be about promoting the IC network or the ICA. I just don't believe that. So I modeled it after National Women's Health Week. So on icawareness.org, which is the website, what we do is we give you all as many resources as we can so that you can use that in your community. Because I'm in Santa Rosa, California. I don't know what the hell's happening in Houston, Texas, or Idaho, or Illinois. I don't know. We're in California. You're the ones who know. So what we do is we try to give you as many resources as we can, from press releases to posters to event ideas, so that you can send a press release to your local paper, tell your story, go to your local county board of supervisors, ask for restroom access, whatever. That's my goal. That's my goal with it, because I don't think that I should be using that campaign to promote me or to promote my company or the other group. I just don't believe that. And I think that money raised in a community should stay in that community. Money raised in Illinois should stay in Illinois to benefit patients in Illinois, right? I mean, I'm very I'm a rebel in that respect. I don't believe that your money should be sent to other groups. I think that if we can keep that money in your community to benefit the patients in your community, bam, we're gold. That's what we need to do. So every year we have a campaign slogan. And I'm going to tell you right now, getting media to do stories on IC is almost impossible. Um, and number one, it's embarrassing. People don't want to talk about bladder pain. Um, uh, Number two, it's not necessarily newsworthy. It's not like cancer, it's a chronic condition rather than it being a quote unquote terminal disease, yada, yada, yada. So finding a campaign slogan that we can use to get as many people we can involved is really, really hard. And so we've used several over the last year. For example, We Stand Together, chronic pelvic pain patients seek compassion and respect. And let's see here. Let me give you some of the other ones. Last 2 years ago, our campaign was on suicide awareness, and it was "We Refuse to Suffer in Silence" IC Awareness Month. And before that, it was "Shining a Light on IC." And before that, it was "Millions Suffer, Few Understand." September is IC Awareness Month. So we got to crank this out uh, really in the next week to 10 days. And I wanted to know if you guys had any interesting ideas on slogans. We stand together, united we stand. I don't know, something like that. Does anybody have any interesting ideas on slogans that we can use for IC Awareness Month? Now, for our media, this is what we do for our media. We always pick a cause. We try to pick something that's newsworthy. So restroom access. We did a big thing on businesses that were who were denying their employees restroom access. We did a big thing on a that was sued, a school district that was sued in San Diego for denying IC patients who were students access to the restroom. So coming up with kind of that media thing is challenging. So I want to plant this seed. I really, really need to plant this seed. And that is, I want y'all to think about it. And if you can come up with any interesting slogans over the weekend, I would really love to hear them. So I really like "We Stand Together." I really like millions suffer, few understand. Something like that, right? So go ahead and think about it. Now, guys, if you have any questions about IC, please don't hesitate to ask them. I'm really happy to take them. I'll stay on as long as we have questions. Um, let's see. Kyle says, I'm in the middle of a flare. How do you know if you have a UTI when you have IC? Well, the symptoms are subtly different. So you're going to have frequency, urgency, pressure, pain with both IC and a UTI. A typical IC flare does not cause fever. A UTI can. A typical IC flare usually does not cause urethral burning unless you're menopausal, but urinary tract infections are notorious for causing burning while you're peeing. I mean, typically for the IC patient, what we ask is, when is your pain the worst? Before you pee, while you're peeing, or after you're done peeing? If your pain is worse before you pee as your bladder's getting full, that points us to the bladder wall, Hunter's lesions, bladder wall injury, something like that. If your pain is worse while you are peeing, as urine is passing through your urethra and you're sitting there going, ow, 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 as we do, that we're going to really look at UTI in that circumstance. But that can also be estrogen atrophy, but mostly it's UTI. And if your pain is worse after you're done peeing, we're going to be really looking at pelvic floor as the dominant cause of that type of pain. Also, UTI, really well known for causing kidney pain, back pain. It tends to be very burny, very sharp and shrill, especially in the urethra. Also, somebody with a UTI is possibly going to have bladder spasms. At least I did the last. I've had two urinary tract infections in 25 years. The last one I thought was a flare. I didn't get it treated for 6 weeks. Finally ended up at my doctor's office crying. They'd never seen me cry before. Kaiser Permanente here in Sonoma County. I was their support group leader for a decade. They had never ever. I am Miss Cool and Calm in a storm usually, and I walked up to the front without an appointment, crying, and the nurse saw me and went, "Oh my God, you need to get back here right now." And what was happening was, as the last couple of drops of urine were coming out of my urethra, I was bending over and screaming with a giant bladder spasm that was shooting up my back and down my legs. You have two different muscle groups in your belly, okay? You've got smooth muscle of your bladder, you got striated muscle of your pelvic floor. You can have spasms in both, but they're treated very, very differently. So when I was describing to her what I was having, it's like, as the last couple of drops come out, holy hell, ow, this hurts like hell. She goes, Jill, don't you know you're having a bladder spasm? And I was like, no, I've never had this before. And that was when they tested my urine and saw that I had a massive, massive infection. It was probably lucky that I didn't have a kidney infection at that point in time. Lisa asks over on YouTube, with pelvic floor dysfunction, does it ever get better? Yeah, absolutely, it gets better. But man, you got to work on it. I mean, here's the thing, for many of you, pelvic floor issues have been going on for years and years and years. Something happened in your childhood, you were in an accident, car, whatever. The longer your muscles have been dysfunctional, the longer it's going to take to fix them. Nothing is going to fix overnight when you've got muscles that are habituated to a tension pattern. There's something called muscle memory. And what happened, I mean, if any of you were athletes, you know that. Like, I was a tennis player when I was younger. I trained specifically to make my body work in a certain way. And literally, I mean, I did it every day for 15 years. If you gave me a tennis racket today and put me out on a tennis court, I can still look like a professional tennis player. I know how to move my body. I have muscle memory. Okay. You can have dysfunctional muscle memory. So if you, as a child, for example, in fact, I was working with a guy earlier this week who remembered wetting the bed and getting beaten. His parents had terrible, terrible strategies for dealing with bedwetting. And so he locked his muscles down in a tension pattern. And he didn't know it. He was a kid. He had no idea what he was doing with his muscles. But by the time he was in his 30s, his muscles were like hard concrete. And they hadn't been normal in decades. And so in his case, man, they've gotten like 30% better, but he's got a lot of work to reverse decades of muscle dysfunction. I hope that makes sense. Over on YouTube, they're talking about doing yoga for their pelvic floor. Also, look at Pilates, guys. In fact, my physical therapist didn't want me to do yoga. He wanted me to do Pilates. Um, Hello, Fairy. Oh, Fairy. Fairy says she's new. You've had this for about 3 to 4 weeks. You're miserable. You're just tired already. So, Fairy, were you just diagnosed 3 to 4 weeks ago, or have you only been having symptoms for 3 to 4 weeks? Let me know. Hi, Tamara. Camera's having a really, people, you're all having flares. Now, come on, we got to fix this. It's summertime. We want you to be feeling good. Lisa, oh my God, Lisa's having a flare too. You got a rescue today. How did the rescue installation go? Dominica says, how does the money that gets sent back to the community it has been raised in El Paso, Texas? None of the urologists I've seen have ever acknowledged this as a true disease. And I don't think there are any groups out here. Dominica, there was a nonprofit called Pure Hope that was based throughout Texas. And, basically, the way you keep the money in your state is you donate to a cause in your state. And usually that's an IC research center. So if you go to icawareness.org, what you'll see is the first thing we all suggest that you donate to is a local university working with IC patients who might be doing some research. Or you donate to your local support group, or you put that money together to start a group on your own in your city. Because, there are a ton of patients with IC in El Paso. There's no doubt about it. And giving them a resource would be a very lovely thing for you to do. Amanda says, she's had a UTI since September. My doctors keep putting me on the same 2 antibiotics I can take since I have allergies to other antibiotics, so my body's become immune to the same ones. It never really gets rid of it. They don't understand how bad it is to have an infection this long. Volcanic pain. Ooh, that boy, hell, girl, now that's a description for bladder pain. Holy hell, that's a good way to describe it. You are the perfect candidate for next generation urine testing. Because what this is going to do is this is going to identify all the good bacteria, all the bad bacteria, and any fungus living in your bladder. But most importantly, it's going to give you drug resistance genes. So it's going to shed some light on what types of medications will be the most effective at killing your infection. Local urologists really are not doing this because they're just learning about it now, but researchers and infectious disease specialists are doing this. And if you go to bladderhealth.org, there's a list down at the bottom of the page of the states where you as a patient can order it on your own. And I've done it twice now. It's absolutely fascinating. I mean, there's got to be a reason why you've had that infection for almost 9 months. The other thing to remember is our urinary. So, one of the great mysteries of the human body is the fact that we have trillions and trillions of bacteria living on us. And those bacteria play key critical functional roles in our body. Some species produce food that our cells eat. Others control other bacteria, et cetera, et cetera. It's kind of like a little bacteria warfare. The good bacteria keep the bad bacteria and the bad fungus in check. And so, what that kind of implies to me is that your bad bacteria are outnumbering your good bacteria. And I'm wondering if you are taking enough probiotics. We got to repopulate the good bacteria to control the bad bacteria. Okay, I got to stand up. Guys, we're doing this thing with sitting and standing today. Hold on. Okay, and now you get to see my. I'm getting old. I can't believe that I started all this when I was 35 years old, and now it's 25 years later, and I can't believe that I'm older. Okay, darn it. Okay, see, this is where the lighting gets all weird. Shoot. Shoot, 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 shoot. Well, is that going to work? All right. All right, that's going to have to be good enough. All right. I also have this handy dandy new thing I'm standing on. For those of us with pelvic floor piriformis syndrome, which is what I have, which is an old tennis injury. I've torn the muscle 3 times. It's torn and scarred. So we have to rotate between sitting and standing. So I just bought this. This is called fluid stance. And for those of us who have trouble sitting for long periods of time and or who have bad core muscles, or at least core muscles that are not working as well as they should, like mine, what we do is you stand on this. It's like a snowboard, right? It's pretty cool. All right. Okay, that was weird. Alrighty, so now if I'm a little squirmy, it's because I'm standing on my snowboard. All right. Okie dokie artichoke. Tamara says, I think I need to stretch. I thought it was all about stretching, but what I found was that I was overstretching and damaging muscles. And that's what my new physical therapist finally, because like I can like literally put my nose on the ground if I'm stretching out. I'm really, really flexible. And he saw me do that and he goes, oh my God, don't do that anymore. You're overstretching your pelvic floor on one side and really creating lots of problems. And I didn't realize I was doing that. Hello, Kenny. Kenny Bernadine. Bernadine from Kentucky, diagnosed in 2000 with IC and Hunner's ulcers. I have pain almost continuously as well as urgency. So, Kenny, have you had your Hunner's lesions treated correctly? Hunner's lesions are treated with laser therapy, fulguration, steroid injection, or hyperbaric oxygen. They really don't respond to anything else. So, I'm curious what you've done for your Hunner's lesions. Hi, Vanessa. Nice to see you. Donna says, Jill, try to remember, we're not just getting older, we're getting better. Man, we're like a fine wine, we're aging well. It's very weird though. It's weird because on the inside I feel 25. I don't feel the age that I am, which I refuse to acknowledge. And I'm in 2 weeks having my birthday and getting 1 year older. Gigi says, another thing, when I have a UTI, I have to pee often, but not just that a lot comes out when I pee. I don't have the urge to pee and nothing's there. Wait, I don't understand that. Another thing, when I have a UTI, I have to pee often, but not just that a lot comes out when I pee. I don't just have the urge to pee and nothing's there. So, you guys, you got to understand that there's something called a false sense of fullness. And with a false sense of fullness, it feels like your bladder's really, really full, even if it's not. So the way I describe this is you go to bed at midnight, you wake up at 1 o'clock, your bladder feels very full, you pee out a quarter of a cup of urine, you go back to bed, you wake up a half an hour later, your bladder feels very full, you pee out a teaspoon, you go back to bed, you wake up 15 minutes later if you've gotten to sleep at all, and you go to the bathroom and you might strain and get a couple of drops. And at that point in time, you know that your bladder is empty, even though you have this false sense of fullness. And that's the sign that the bladder wall is really badly provoked. So that's what you're going to get if for those of you with Hunner's lesions, if you really screw up with your diet or even bladder wall. Amanda has ESBL, bladder infections, that you get admitted to the hospital for high dose antibiotics. Girl, I am so sorry. I did a big story on that a couple years ago. Donna says something very interesting over on YouTube. She says, and let's see, hold on a sec. So they're kind of talking over on the YouTube support group about how our bladder and our bowel symptoms often come together. And that's very true. You're going to notice, for example, for those of you who have IBS, that on moments when you've got IBS diarrhea and you're having bad cramping, you're probably not going to be able to pee for 15, 20, 30 minutes because your muscles are all in spasm. Donna here says, if I have a bowel movement, my nerves get turned on and my vulvodynia goes crazy sometimes. And again, I have no shame. I'll talk about anything. What I noticed for me is that if I'm going to have a bowel movement that's slightly uncomfortable, my feet will tingle every single time. Like as soon as I feel my feet tingle, I know within 10 minutes I'm going to need to be near a restroom, and that's just because of a proximal location of that nerve next to the bowel. And if I have something that's fairly large going through the bowel, it pushes against the nerve and it makes my feet tingle. So we all have kind of interesting anatomies there, right? And here on Facebook, you guys are talking about the crystal wand for work. And let me show that to you. Where is it? Where is my wand? My demo. Here. I'll be right back. Here we go. I found it, baby. I found it. Let me get back on my snowboard under my desk. It's pretty funny. Gotta say, I feel a lot better with it though. All right. So for those of you who are doing pelvic floor physical therapy at home, you know, pelvic floor physical therapy, as I like to demonstrate, when you've got tight pelvic floor muscles, um, you have to remember that our goal is to lengthen them and get them to their normal consistency. So muscles are normally long and lean, right? But if your muscles are tight, the physical therapist's job is using a finger to get slowly go in there, right? And all they're going to do is they're going to very gently try to massage these muscles back into a long position. And the physical therapist is obviously limited by the length of their finger. So it's a very interesting thing to go through, and you should never be embarrassed about having pelvic floor physical therapy. I mean, and that's how you access these muscles. These are not muscles that you can reach when you are uh, uh, reach from outside the body. The only way to reach them is internally. So for a woman, you're going to have a vaginal therapy. For a man, you're going to have rectal therapy. One of the things that you can do at home is use a glass wand. And obviously, you're going to hold. You can do it in a lot of different ways, right? But here you've got tight muscles, and as you insert this in your vagina or your rectum, you're basically going to just kind of move it along the length of the muscles. And you know, if this is your vagina, you've got 12, 6, 9 o'clock, 3 o'clock. Your physical therapist will tell you where you need to work it because everybody's different. And obviously, you're not going to push it right on your bladder. But and then we even have a much longer one for people who are mobility impaired or they might be overweight and they can't quite reach things. We have one that's about this long. Oh my God, I had a hysterical one that somebody sent me. I should have saved it. It would I donated it. But anyway, for those of you who need pelvic floor work, the most important thing isn't when you actually go work with a physical therapist, it's what you do when you get home. You got to figure out why your muscles are tight in the first place. Is it an old injury? Is it an exercise that you're doing incorrectly? Something, anything. And then it's what you do at home to try to address that on a daily basis. Okay, so Ferry, getting back to Ferry, thank you, Ferry, thank you for your patience. It takes time to get through the Facebook feed here. You were diagnosed 3 weeks ago. Well, welcome. I'm sorry that this is your diagnosis, but seriously, you're not alone. You found a warm, soft place to land, and we will do our best to try to help you understand this. So, one of your first things that you've got to understand, Ferry, is that we don't think of IC as an incurable bladder disease anymore. We don't. Why? Because there are structures outside of the pelvis that are often involved for IC patients or outside of the bladder. So we think of IC more as a chronic pelvic pain syndrome. And if you were to visit a support group, an in-person support group, what you would very clearly see is how different we are. There's kind of this perception. There's this perception that we're all the same, that we all have a basic bladder issue. And that couldn't be farther from the truth. Some people have bladders that look like bloody hamburger. And I've got a picture here. Okay, so look, some patients have bladders that are really badly damaged. These are Hunner's lesions. If you've never seen a Hunner's lesion before, I'm sorry, I'm moving. I have to get stable on my snowboard. This is hysterical. Okay, I'm stable. So the interesting thing about these Hunner's lesions is that they have a center appearance and then they've got lines down there. So when you look inside people's bladders in the IC community, about 5 to 10% have Hunner's lesions. And then some of you have petechial hemorrhaging. And then many of you, myself included, have a completely normal bladder. Yet we're all diagnosed with IC. Are we the same? Absolutely not. We are not the same at all. Some patients have terrible pain, others have no pain. Both diagnosed with IC. Are we the same? No. And when you ask people when their symptoms began, that's where you really see the diversity. Because for some people, IC begins in childhood, while for others, IC begins after menopause. For some people, IC begins after chemotherapy for cancer, while for others, IC begins after having a baby. For many people, IC begins after a car accident, some sort of trauma, or a fall, or a rape, or a history of abuse. Those are all things that have triggered IC. Are they the same in every patient? Absolutely not. And so, what we're doing, and we also have to throw in the knowledge that a one treatment fits all approach does not work. I mean, we've known that for 20 years. One treatment does not work for everyone, not even closely. So for the last 10 years, what we're doing is we're trying to understand the diversity in the IC patient population. We need you to find and understand your own unique case of IC, because you're going to be different from almost everybody else you meet on Facebook. And that's why Facebook gets a little dicey. Any support groups gets a little dicey as you get patients with completely different conditions giving each other advice, and that gets very, very tricky. So what we're doing now is something called subtyping. We want to try to understand your unique variation of IC. And let me get my notes here. Let's see here. Okay. So in Europe, okay. Okay, I'm stable. Okay. So in Europe, they have 12 variations of IC. They do a biopsy, they look at your bladder, they look at your symptoms, and they can diagnose you based upon a 12-point system. In Canada, they use a 6-point system. In the United States, we don't have an agreed upon system as yet. However, I use a system that was created at Stanford University by Dr. Christopher Payne, and I think he nailed it. So let's just go through these real quick. I think you'll find them very helpful. So when Dr. Payne introduced his subtypes, he did it in a really provocative way because he said we should treat IC patients like cancer patients. And I'm like going, oh my God, why would you even say cancer and scare patients? There's no relationship between IC and cancer. And he goes, no, you're entirely missing the point. You're right. There's no connection between IC and cancer. But when somebody is diagnosed with cancer, they're given a very, very specific diagnosis. They're told that they have cancer of the left breast. It is estrogen dependent type 1, 2, 3. Your diagnosis of cancer is so clear that you absolutely know what your treatment should be. There's no doubt about it. And he argues very, very successfully that a diagnosis of IC does not give you any hints on what treatment you should do. There's no intuitive pathway when you've been diagnosed with IC. You really have no idea what to do next. So how do we get that intuitive pathway? We focus on your unique case of IC, and we do it with specificity. Okay. All right. So, all right. So let's do this. So this is Chris Payne, 5 subtypes of IC. He's now at Vista Urology in private practice with his wife. They are the top pelvic pain center in California. So if you're in California on the West Coast, you could go see them for a second opinion if you wanted. IC subtype 1, Hunner's lesions. Everybody in the world agrees this is a distinct group of patients. Why? Because when you biopsy those tissues, they are different than everybody else. They have massive inflammation. And so everybody agrees that this represents a completely different condition. And in fact, there has been a move to separate Hunner's lesion patients from everyone else so that you can have your own treatment guidelines, you can have your own research. And that's kind of what they're doing in Europe and Canada. I mean, in the United States, they're still keeping them together, which I think is a mistake. Hunner's lesions require very, very specific therapy, laser therapy, cauterization, fulguration, steroid injection, hyperbaric oxygen, or the Lyris device, which sadly Allergan has deprioritized. Lyris is the first treatment in history to actually heal Hunner's lesions in 2 weeks, but it wasn't making them enough money. And so, bam, they shut it down. IC subtype 2, bladder wall injury, bladder wall driven. For these patients, their bladder wall is the source of their pain and discomfort. How do we know? Because they have pain as the bladder fills with urine that is relieved by urination. So the fuller they get, the worse they feel. You guys hold on to that YouTube conversation. Holy hell, you're doing a great job with some of these concepts for IC Awareness Month. I love it. Okay, so we know your bladder wall is driving your pain and symptoms. If you have pain, as your bladder fills with urine that is relieved by urination. So the fuller you get, the worse you feel. You're going, oh my God, oh my God, oh my God, oh my God. And as soon as you find a bathroom and empty your bladder, it's like, oh, thank God. Okay, why? Let's think about that for a moment. Let's look at this picture. Okay, so here's a bladder wall. So here's the bottom of the bladder. Now imagine urine filling this up. Wherever urine hits the wound, it goes into the wound and it causes pain. So the fuller you get, you got more urine in those wounds, and it gets worse and worse and worse and worse, and you're in agony. And then, bam! As soon as you empty your bladder, you feel much better. You might only feel better for 5 minutes, but that sensation of feeling better tells us your bladder wall is driving your pain. In this subtype, we've got subtypes. So we know that in this case, it can be chemical injury from chemotherapy, diet soda, too much coffee, etc., too much herbal tea, green tea, black tea, soda, artificial sugar. Chemicals can irritate the bladder. There's no doubt about that. We also know that the bladder wall is dependent on estrogen. And so if you happen to be low estrogen, that means your bladder wall is not as resilient. It's going to be thinner. And again, it's going to be more sensitive to food. And of course, we can have a chronic fungal infection or a chronic bladder infection. That's not for everyone. That's for a small subset of patients, but it's real. Okay, IC subtype 3 is a muscle injury, pelvic floor driven. This is the biggest subtype by far. So these are the patients whose symptoms began not after a bladder injury, but after a muscle injury, like having a baby or a car accident or a fall, or a history of athletics where that pelvic floor has been traumatized, like if you were an ice skater or a gymnast or a wrestler or a football player. You know, let me get my handy dandy demo. I use a tennis ball this time. Okay. So here we go. So here's your pelvic floor. Your pelvic floor's job is to hold your organs in place, including your bladder, right? So we have what I call the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. The odds are they're both involved to some degree. It's very hard for them not to both be involved because they're so intricately connected. So there's a group of patients whose symptoms begin after their bladder gets hurt, like chemotherapy. So here you go. You've got a bladder that's bathed with chemicals, it's pulsing in pain, and your muscles get tight to protect them. We call that a guarding reflex. And a good way to think about that is you think about a guy who gets hit in the testicles. What does he do? He bends over and he cups himself. And he might fall on the ground. And if you could pry his fingers off of his testicles, you would see that they were being pulled up into his belly. That's the pelvic floor in action. Whenever you're in pain, your muscles get tight to protect you in the guarding reflex. So for this patient who's got a throbbing bladder and their muscles get tight to guard them against that pain, our therapeutic priority is to calm and soothe the bladder. We know when we calm and soothe the bladder that the muscles will eventually release. Okay? But that's not the big group. The big group is the opposite. Here you've got this beautiful, happy, healthy bladder, and you get hurt, and your muscles go bam, like this. And all of a sudden, your healthy bladder is being restricted by very, very, very tight muscles. Now you have no clue you have a muscle injury. Your first symptom is frequency urgency. You call the doctor, you say, hey, I got an infection. The doctor goes, you probably do. They throw you antibiotics. Bam, the antibiotics don't help. You go back to the doctor, and the doctor goes, maybe you've got overactive bladder. They throw overactive bladder medications at you, and eventually those don't work either. And then you go back to the doctor, and at some point in time, they say you've got interstitial cystitis. So then they throw Elmeron at you and hydroxyzine and Atarax at you, Atarax, Vistaril, amitriptyline, Elavil, etc. And those don't work either. No, if you're one of those patients where you try every freaking bladder treatment and nothing is working for you, there it might be a very good reason why. Because in this patient, the bladder isn't the problem. The problem is tight freaking pelvic floor muscles. Look at what happens. Look, if I dare you to squeeze your forearm for 5 seconds and then let it go. You see how white it gets? Because when you squeeze it, it drives the blood flow away. Tight pelvic floor muscles drive the blood away from the bladder. Then the bladder isn't getting the nutrition it needs. It's not getting the oxygen it needs. And bam, before you know it, the bladder wall might start to break down. But for this group of patients, our therapeutic priority is to restore blood flow. How do we do that? By working on the muscles. Our muscles are always going to be the first priority. When we get these muscles nice and released, then the bladder starts getting the blood flow it needs, and the bladder can be in better shape, and your muscles will be in better shape. Okay? Important to understand that of all the therapies ever studied, the single most effective therapy that outperformed every other therapy was pelvic floor physical therapy. And when that study came out in 2008, it turned the IC world on its head, because up to that point, we all considered this a bladder disease. And when that study came out about pelvic floor, everybody went, oh, hell. Well, if working with the muscles makes this better, then maybe there's a muscle problem for some people. And it turns out we think the muscle component is actually the biggest subset of IC patients. All right, so that's IC subtype 3. IC subtype 4 is a nerve injury, pudendal neuralgia. Now, these are the patients whose symptoms are very positional, and they're being driven by a nerve. So in other words, they often sleep just fine at night. They don't get up at night to pee. But when they sit on the side of the bed, it hurts like hell. Or when they move, it hurts. Or when they bend over, it hurts. Or when they sit down, it hurts. And in this case, that's usually because they have muscles so tight, they're impinging on a nerve. So your therapeutic priority for this group is to calm and soothe the nerve and to figure out what the heck is impinging on that nerve, creating that entrapment. And then the last subtype is central sensitization. This is one of my subtypes. These are the patients where it runs in families, like it does for me, my mother, my sister, my grandmother, my aunt, my cousin. Going back generations, we all are known for being a very sensitive. My mother diagnosed with honeymoon cystitis. My sister diagnosed with honeymoon cystitis. My aunt, my grandmother, all of them, because that's what they called it back then. This subtype means that you have a sensitive nervous system, not just in your bladder, but throughout your body. You've got very sensitive skin. I have wickedly sensitive skin. You tend to be drug sensitive. A normal dose of a medication doesn't work for you. You got to take half doses, baby doses. You tend to be food sensitive, not just for your bladder, but for your whole body. Like for me, it's oatmeal and chocolate, destroy my guts. My bowel goes insane if I have oatmeal or chocolate. We tend to have a wicked sense of smell. We can smell things that other people cannot smell. And smells really drive us crazy. But there's a good side because with our wicked sense of smell, we find gas leaks and we're the first to smell the fire. I just found my third gas leak in my neighborhood. And the gas company is always stunned that I can smell it, but I can. And we tend to be wickedly chemically sensitive. And so a normal chemicals, which don't bother most of you, will bother us. A chemical will stimulate pain and discomfort. We're the ones who we tend to be the cause of the signs in offices saying, please don't wear perfume. Because for some of us, perfume is painful, or Febreze, or a scented candle, and all that sort of stuff. So central sensitization is not a disease. It is usually just the way you're built. Hello, I'm a redhead from Norway. It kind of makes sense in my case. Or it can happen after traumatic injury. And so our therapeutic priority for this one is to protect and calm and serve our entire our nervous system. It means that we obviously are not going to do anything with caffeine, anything neurostimulatory, which is going to turn all of our nerves on. And we tend to live a quieter life. We're not really happy in a big city. We tend to do better in the country where it's quieter and where we have a little bit more control. All right, so fairy, those are 5 distinct groups. So it'll be very interesting to see where you fall. And the most important question that I can ask you is, when is your pain the worst? Before you pee or after you're done peeing? So if you want to answer that, go ahead and I'll go through some more questions. Donna Townsend was talking with Robert Evans, Dr. Robert Evans, our Doctor of the Year, and he said that subtyping and subtyping is important for the IC movement moving forward. Christy, I won't tell a group what you're doing at this moment, but girl, I wear a headset throughout the day, and you wouldn't believe how many times I'm doing that too when I'm talking to patients. Donna, using Flexeril for pelvic floor. That's exactly what I use. All right. Gigi says, I'm having a flare too, but it also could be because I have a cold and you're using zinc lozenges, throat coat, and echinacea tea. Yeah, you got to be real careful with your herbal teas. I had that wicked cold this winter, and I was doing the medicine balm teas from Starbucks, and they really helped me. I mean, I got to tell you, I could swallow, I stopped my throat and all that sort of stuff. But I in hindsight, I was thinking about that afterwards, going, that was a little risky. I mean, it didn't kill my bladder, but I'm IC subtype 5, subtype 3. I wouldn't recommend that for IC subtype 1 or subtype 2, Hunner's lesions or bladder wall. Devon says, not new to the IC world. You were diagnosed 18 years ago, recently found that it has been getting worse. So Devon, I can't tell if you're a man or a woman. I apologize. If you're a woman, it's probably estrogen atrophy. You're probably now starting to deal with the influence of the loss of estrogen on your bladder, making your bladder more vulnerable. Estrogen atrophy also ends up with weaker pelvic floor muscles, so then your pelvic floor muscles get a little funky too. Ferry says your doctor prescribed Detrol and amitriptyline. So far, no relief. I wouldn't expect relief with the Detrol. The amitriptyline, what that does is kind of calms nerves down over time. But, it depends upon where your pain's coming from. If your pain is coming from your muscles, then we want to do a muscle relaxant. If you went into any major IC clinic today, at that very first appointment, they would be doing a pelvic floor assessment. And so, have you had a proper pelvic floor assessment? And have they told you if your muscles are tight? Kenny says, I have pelvic floor pain, side pain, back pain. What supplement would you suggest? Bladder rest, bladder builder. As I said earlier, diagnosed in 2000 with Hunter's lesions, had RIMSO installations, stain and flare almost continuously. I go to pain management, getting ready to start nerve blocks and physical therapy. Again, cause and effect. Kenny, we have to understand your fundamental underlying condition that's triggering all of this. And the odds are it's probably muscle because it tends to be muscle injury in many men. And so if you have tight dysfunctional muscles, no supplement is going to fix that. You need to be in pelvic floor physical therapy. And dude, and I say that fondly, I love saying dude. Okay, you need to get this book, Ending Male Pelvic Pain. This book will teach you more in 5 minutes than you've learned from anybody about your muscles down there and what's going on. And it's absolutely filled with things that, with obviously it's male models, with things that you can do to work on your pelvic floor. Okay. And so this is critical here. But if you think that your bladder wall is also involved and you're looking for a supplement, and given the fact that you have a lot of pain, I would do the bladder builder because that's the first supplement that contains PEA, which we know has pain fighting properties to it. So that would be the one that I would be very tempted to do, would be bladder builder or Peora. Peora is not available yet. Hopefully we'll have it in the next 10 days to 2 weeks. But remember, I'm not a doctor. I can't give you medical advice. What I'm just trying to do is share with you what your options are and try to educate you. Always talk to your doctor about it too. And if you don't know the health of your pelvic floor, you need to have a pelvic floor assessment because in the end, we want to make sure we know we're treating the right thing. I'd hate for you to spend a lot of money buying supplements only to discover after the fact that supplements would do nothing for it. It'd also be very interesting, honestly. One of the things that you can do to kind of rule out tight pelvic floor muscles is try a little bit of a muscle relaxant. If taking a muscle relaxant makes you feel better or taking a hot shower makes you feel better, then that tells us that tight muscles are part of your issue. And just so you know, we really don't do RIMSO anymore. RIMSO bladder installations are pretty rare now in favor of heparin lidocaine rescue installations or Elmeron lidocaine rescue installations. Nanda says, an infectious disease doctor I've been told to see. You have a chronic condition where I always make kidney stones too. Girl, holy hell. If they're sending you to the infectious disease specialist for bladder infections, I support that. I think that's great because they have more resources, they take it more seriously, they have more access to better testing. So I think that that's a really good idea. The challenge here is that your kidney stones. So in case you don't know, kidney stones tend to be covered with bacteria. They become little bacteria factories, and so imagine a kidney stone, yeah, and kidney stones are also very sharp. So here you've got this sharp bacteria covered thing going down your ureter into your bladder, and everywhere it touches is kind of irritating, touching, cutting, and that bacteria is being deposited in that potential wound. Granted, superficial wound, but still it's there. So you've got an interesting journey ahead of you. I don't know. I don't know what you would be doing. If you consistently have E. coli, then you might need to be on a prophylactic program, maybe with D-mannose, something like that, so that you can at least try to keep some of that bacteria in check, combined with a really good probiotic, prebiotic program, also to get the good beneficial bacteria back in your bladder so that they can kill the bad bacteria. Amanda says she tried dry aloe pills or cranberry. Okay, now, girls, apples and oranges. Do you know which one? Can't compare them at all. The aloe company that we think is, the most reliable is Desert Harvest, because they have done um, research studies with their product in IC. All the new bottles have a new label, so the new bottles are brown and green. So if you see new labels, don't freak about that. What I meant is I pee a lot. Whenever I pee, a lot comes out. Okay. Catherine, you knew me before you were at the ICN. You were one of the first IC people I reached out to. My urologist told me about. Oh, how cool is that? That had to be some time ago. If you know me, you know I'm a rebel. I'm a rebel at heart. My old IC blog was called the IC Underground, because I really rebelled against the status quo. And now if people think that I'm status quo, I get really angry, because I'm not. I'm not at all. I mean, I'm really interested in the hot new research and trying to understand it. I'm not conservative at all. I'm pretty liberal in my viewpoint with respect to IC. Dominica, just came across a Desert Harvest IC starter kit. It's aloe pills. Haven't gotten it yet. Any insight if this is harmful? It's worth it. Well, Dominica, the problem with aloe is that there's definitely a subset of patients who are aloe intolerant, and it can give you bowel symptoms. It can give you diarrhea, stomach ache, and there's really and it's not a small group. I mean, I would say that like 20 to 25% of patients that try the Desert Harvest that we sell let us know that it's a little irritating to their gut in some way. So I don't know if that would be the one that I would start with. We don't know if you're aloe intolerant or not. I certainly wouldn't get a lot of it. Don't buy 3 bottles. Just buy 1 bottle and try 1 capsule and see how you do. But I think it would be really, really interesting to look at the bladder builder or the bladder rest as options. Vanessa, I was prescribed Elmeron, gabapentin, hydroxyzine, amitriptyline. What are your thoughts on being all those meds at the same time? I'm very hesitant and nervous to take them all. Well, your insight is very smart, hun, because hydroxyzine and amitriptyline have been linked to cognitive decline if they're used if they're used for any duration of time in larger dosages. And that's not just for older people, that's for young people too. So, and in fact, something else just came out about that again in the last week, I think from the FDA. Now, there's a pharmacological principle called lowest effective dose. What's the lowest amount of medication you can take and get some beneficial effect from it? As much as the pharmaceutical companies would want you to take more because that means they sell more, for those of us who are sensitive, we do better with tiny, tiny doses. As an example, I have hydroxyzine right now because I'm dealing with a rash. The green visceral capsules, I cut it in half and then empty half out because I'm very sensitive to meds. So if you look at the American Urology Association 6-step treatment protocol, which I can get for you, let's get that and go over that real quick. Hold on. So one of the problems that we've had in the IC world in the last 25 years is that doctors around the United States have treated IC patients very, very differently. And it's very, very confusing for the patient because some doctors will say surgery is the only treatment. Other doctors will say Elmeron's the only treatment, while others will say Interstim is the only treatment. And so what happened about 10 years ago is the American Urology Association convened a panel of 30 experts and patient advocates to create a consensus-based treatment plan. And they did a really good job with it. This is ideal for IC subtype 2 bladder wall driven. Now, this was created before we really understood the subtype. So It'd be nice to have treatment protocols for every subtype and all that sort of stuff, but we don't have that. So let's go over this for a moment. So American Urology Association 6-step treatment protocol was released in 2011, revised in 2014. And you can go over to the American Urology Association website, auanet.org. In the upper right-hand corner is a link that says guidelines. Go over to the guidelines, click on it, and go into the guideline area, then search for interstitial cystitis, and then go into the IC guidelines. They're about 50 pages long. And I want you to print out 3 copies of the guidelines, one for you, and I want you to read it, and I want you to learn it, and I want you to use your marker and highlight it, okay? One for your doctor, especially those of you in rural areas where you've got medical care providers who don't know what the hell to do about IC. Seriously, print it out and give it to them and say, hey, doc, here are the guidelines from the American Urology Association. In case you haven't known these, this is what I'd like to do for my IC. And then you always carry one in your car or in your kit. So if you end up in the emergency room, you've got a set that you can give to an emergency room doctor who I promise you has no freaking clue what IC is, okay? So the AUA guidelines have 6 steps, and the steps are arranged with respect to the risk of adverse events. So they don't want you to do step 6 until you've done the easy stuff, step 1. So let's go over their steps. Step 1 is improving your water intake, because seriously, if you're dehydrated all the time, your urine is really dark and irritating. So we need to improve your water intake. We need to modify your diet. If you're drinking coffee every day, I mean, seriously, people, seriously, you wouldn't believe the patients who call me crying in pain, and they admit they're still drinking a lot of coffee every day. It's like, hello, if you had an open wound on your hand, would you pour coffee on it every day? And the answer is no, of course you wouldn't. Now, please think of your bladder as wounded. Would you pour coffee on an open wound in your bladder? The answer should be no, hell no. If you're drinking coffee every day, you're bathing that wound in acid and you're making that wound bigger. That wound will never heal if you're pouring acid on it every day. Okay? So in these guidelines, please, diet modification. They also have supplements. Why? Because the supplements have been around for almost 20 years. They might not have a lot of big research studies behind them, but in the clinical office, tens of thousands of patients have used Preleaf. They've used Cystoprotect. They've used Cystorenew. They've used Desert Harvest Aloe. There's a decade or more of history of these supplements helping IC patients. But most importantly, the supplements do not carry the same risk of adverse event as Elmeron, hydroxyzine, amitriptyline, Vanessa, just so you know. All right. Also in step 1, muscle relaxation and acupuncture, because we actually have an acupuncture study that was released a month ago where when it was done in a specific way, IC patients didn't need any pain medicine. The acupuncture took control of their pain. So acupuncture is viable and the risk to benefit ratio is outstandingly good. Okay. So basically you're drinking water, you're changing your diet, you're trying to supplement, usually for 3 to 6 months. That's what most doctors would do, is they'd give you this, send you on your way. You're going, what? You're making me wait? But believe it or not, the step 1 works for many, many patients. Just diet modification alone works for many, many patients. But let's say that doesn't get you better. What are you going to do next? You're going to go to step 2. Step 2 is physical therapy if you've got tight muscles, oral medications, bladder installations, and pain care. So Vanessa, let's go back to the medications that you're on. So you're on 3 of the 3 top oral medications for IC: Elmeron, hydroxyzine, and amitriptyline. Elmeron acts as a bladder coating. It's kind of like a synthetic Band-Aid. It's a chemical Band-Aid that covers your bladder wall. Elmeron was FDA approved in 96. It's the only oral medication approved for IC. Unfortunately, it has a number of things going against it. Number 1, it is very expensive now. Some patients have to pay 2,000 a prescription, and who the hell can afford 2,000? I can't. I couldn't even afford 500 a month, really. I mean, seriously, none of us are rich here. Elmeron, uh, only according to what was my source? In a research study done by Baker Norton when Elmeron was first approved, the bioavailability of Elmeron was estimated at 7%. That 7% of the Elmeron arrived in the bladder, 93% was destroyed by digestion. However, another doctor, and I've got it in our magazine we're working on, Dr. Elliot Lander, gave me a new statistic where they say only 2.5% of Elmeron arrives in the bladder when you take it by mouth. So that is absolutely terrible bioavailability. And because so little arrives in your bladder, you have to take a lot of it over time to get enough in there. And that's when side effects happen. So Elmeron is a blood thinner. If you have to have surgery, you've got to get off of the Elmeron anywhere from 2 to 6 weeks before the surgery. Elmeron is notorious for causing gut distress, diarrhea, stomach ache, hair loss, changes in liver enzyme levels. And the most serious side effect of Elmeron is something that was only discovered last year, and that is retinal disease, pigmentary maculopathy. We now believe, and researchers at the Emory Eye Center discovered that Elmeron users who had taken it for a period of time had something building up on their retinas, changing the color of their retinal cells. And these patients were having difficulty reading, difficulty in low lights, retinal hemorrhaging, you name it, it was happening. So Vanessa, as a medication, Elmeron has very few things going for it at this point in time, and a hell of a lot going against it. In terms of research studies, depending upon who did the research, Elmeron, no better than placebo, about placebo. There's no doubt it helps some people, but given the side effects, clearly it is falling out of favor, especially when you've got supplements like Bladder Rest or Cysto Protect or Cysto Renew that can give you that bladder coating effect without the other risks. So that would be one thing that you're taking that I would have questions about. And if you come to our website, you can read the article that we just did on the Elmeron eye stuff. It's very new, breaking. We have a citizen petition with the FDA. It's the hot story for the last 9 months in the IC world. The gabapentin you're taking is about calming nerves down. So if you've got nerves that are irritated and your body's tolerating the gabapentin, you're good. Hydroxyzine is about reducing mast cell activity. It's about controlling that response that happens. When you get a mosquito bite, the mosquito injects venom. In fact, I've got a couple of where am I? Look at these are my two from 2 weeks ago. Oh, I hate mosquitoes with a passion. So what turns them red and gets them swollen is your body senses the venom, and mast cells release histamine, and that causes an allergic reaction or an histaminic reaction, the release of it's not substance P, histamine, the release of histamine. So, and we used to describe IC years ago as kind of like 1,000 mosquito bites at once in your bladder, because wherever urine is getting into that wound, it's causing that same mosquito bite-like reaction. The histamines are being released, causing irritation. And then the amitriptyline is about calming nerves down. The challenge with the amitriptyline, again, is side effects. Amitriptyline has a lot of potential side effects: dry mouth, dry eyes, racing heart rate, strong PVCs in your heart rate, weight gain, 20-pound weight gain, drowsiness, etc. So if we were to use the AUA treatment protocol for you, Vanessa, we would be starting at step 1 before going to step 2. And that's not me saying that. That's the American Urology Association saying that. So I think you've got some important concerns that you can raise with your doctor. The Elmeron at this point in time, in my opinion, is pretty dead in the water. Now, the company would be furious if they heard me say that, but risking eye damage is serious. And between the high cost of it and all the other stuff, patients have been abandoning Elmeron right and left. A better way to take Elmeron would be to take it directly in your bladder in the form of a bladder installation. So if they did a Elmeron lidocaine bladder installation that they just put right in your bladder, you don't swallow it, doesn't go through your body, doesn't hit your eyeballs, all that sort of stuff. A better, safer way of using Elmeron is to use it in installation. And it's Dr. Elliot Lander who is actually putting Elmeron in liposomes and putting that in the bladder. So that's interesting. Okay, let's go to step 3. Step 3 as treatment is cystoscopy with hydrodistension and Hunner's lesion treatment if you've got lesions. So that would be steroid injection, etc. I've already said that multiple times. Step 4, oh, and here are the treatments for Hunner's lesions: fulguration laser therapy, steroid injection, Lyris. Step 4 is neuromodulation, which is either the ankle stem or the sacral pudendal stimulation or Botox. Now, some of you I know have, when you go back to your doctor for your second appointment, the doctor is going, hey, let's do some Botox. Botox is in step 4 for a reason. If Botox goes bad, it goes really bad. Because what happens is as they inject the Botox in your bladder wall, if they accidentally hit a nerve which controls your ability to pee, you will not be able to pee, and you will have to self-catheterize for several weeks or months until the Botox wears out. So again, risk of adverse event. Botox is in step 4 for a reason. Step 5 is cyclosporin. Now, cyclosporin is used for people with immunological issues. This is immune suppression. And I want to get that right. I'm kind of getting tired now. If you had a kidney replaced, they would give you something to prevent the rejection of the new organ. Cyclosporin depresses your immune system, and so it makes you vulnerable, more vulnerable to colds and things like that. But when it comes to Hunner's lesions and or patients who are really immune compromised, this is a real game changer. And the reason it's in step 5 is because it also has some pretty serious risks of adverse event, notably very high blood pressure. But I was working with a gentleman a week ago who had suffered for years, and his doctor finally put him on cyclosporin, and he's symptom free. He said, a complete game changer. He now has his life back after suffering from years. So there is a time and place for something that's a little bit more risky, like cyclosporin. And then the last step is surgery, and the surgery is very, very rare, very rare. But if your bladder is badly traumatized, if it's very, very small and there are other issues going on with it, then they might be talking surgery. But again, very, very rare. Treatments that are no longer recommended, just so you know: long-term antibiotics, BCG, racinoferritoxin, silver nitrate, chlorpactin, high-pressure distensions, and long-term steroids. Alrighty. So that is your 6-step treatment protocol from the American Urology Association. And it works well. It puts your safety first. And that's important. If you're taking a medication which the side effects are so severe that your quality of life is diminished, then it is probably not the medication for you. And it's important that you know that there are other options available. And when you think about the subtyping, it's important to remember that if you are not responding to bladder therapies at all, then the odds are you might not actually have a bladder problem. It might be muscular instead, right? And so we want to be doing that pelvic floor physical therapy. Here, let me get a drink. What do you guys have for dinner? You know what I had for dinner? I had an avocado and cucumber sandwich and blueberries. I had a really good day, food day. Normally, I would be chowing down on something bad at this point in time, but I went and bought a whole bunch of blueberries and blackberries at the store the other day. That is my snack for tonight because I am, you know what? It's like, hello, hello, belly. I didn't have this belly before my hysterectomy. It's driving me crazy. I want to lose like 10 pounds. All right. Ellie's having an awful flare right now. Ellie, I'm so sorry, hun. Okay, Ellie, if you sign up for the free newsletter on the IC Network website, you can download our free flare management guide because there are different types of flares. You can have a bladder wall flare, you can have a pelvic floor flare, you can have a hormone flare. Go sign up for the newsletter. I only send out newsletters once a month, once every 2 months. And you might get some help from that flare management guide to get you through tonight. It has hour by hour rescue plans, and it will help you understand the different types of flares you could be having. So Bernadine from Kentucky, diagnosed in 2000 with Hunter's lesions. You had bladder washes with DMSO, helped for a while, then caused more pain. You go to pain management, getting ready to have nerve blocks. I have pain in the sides, pelvic floor, almost urgency frequency. I stay in a flare. All right. So, girl, or guy. I'm sorry, guy. You're a guy. No, I don't know. Are you a guy or are you a girl? Okay. I don't know. I hope I didn't offend you. Okay. The most important thing that you said is that you were diagnosed with Hunter's ulcers. Have they been treated? They have to be treated. When you treat the ulcers, the pain usually goes away dramatically. If you don't treat the ulcers, you're going to be in pain as long as you have those active ulcers. So we got to make sure those ulcers are treated correctly and promptly. If you don't know, you can go to our website and read our section on it. So the question is, what supplement would you suggest? I would, no supplement's going to fix Hunter's ulcers. We got to have a reality check here. But the supplement that might help you with the pain would be Bladder Builder. So the Bladder Builder might be, because it's got the PEA in it, might be really helpful. But ultimately, in the end, we got to treat the source of the pain. And if that's active Hunter's lesions, we know exactly what to do about that. Gigi says, your sister-in-law said to your sister one day that she thought I liked being kept busy worrying about my health. Oh my God. Seriously? Seriously? IC keeps us busy? Oh, it's ridiculous. That's how I feel about that. That's ridiculous. It's not worth responding to be quite honest. But what would I say in that situation? I would, how would I respond to that? You know what I would do is I would get the AUA guidelines out and hand them to her and have her read them. Say, you want to know about my condition? Here's my condition right here. You want to read about it? Here it is right here. Or you go to our section on Hunter's lesions or a section on our website with videos and you show her the video of a bleeding bladder wall. That'll shut her up. And sometimes they need to be shut up because it's so offensive. I mean, guys, I don't believe in being rude. I don't believe in being rude to somebody, but there comes a point when if people are being rude to you, man, you got to say stop. This is not okay. You cannot look inside my body. Let me show you a picture of what I've got in my body. Let's see. How would you feel if you've got a bloody bladder wall that hurts every time you drink something? Man, you got to slam them down with facts. Slam them down with facts. So you guys see, I'm behind in your stuff. So Gigi says she's got subtype 2, 3, and 4. Vanessa subtype 2, 3, and 4. So that makes sense, but you still got to figure out what's primary and secondary. Linda says perfumes and candles are horrible. Cheryl says she's got 1 and 2 from drinking too much Diet Coke. Cheryl, you better damn well have stopped that Diet Coke. In streaming circles, because I watch a lot of streamers now trying to learn how to do this. There's something called dark mode, which is normally at night, and dark mode means you swear more. And normally we declare dark mode. I've never done a dark mode broadcast, so I apologize if my swearing offends anybody. But it has been a long week, and frankly, Diet Coke is brutal. Dominica, she says she's got a 1 and 2 from a car accident. Car accidents don't cause Hunner's lesions, hun. Hunner's lesions we think might be viral. I would suspect that you actually have a muscle injury if you had a car accident. And Cheryl, I'm looking at you the next time you even look at a Diet Coke. You better not have any Diet Coke in your home. I mean, seriously? Seriously. Karen asks, is there a book like that for women? Absolutely. Ending Female Pelvic Pain by Isa Herrera. You can buy these right now in the ICN shop. Please don't go to Amazon and buy them. Please buy them from us because that helps make this happen. You know? Alrighty. Gigi, I have estrogen atrophy as well as vaginal atrophy. Vaginal estrogen was a game changer. It stopped me getting constant UTIs. Absolutely. Absolutely. And what's so interesting for me, my estrogen atrophy is not internal as much as it is external. It's amazing how dry I've gotten down there. It's amazing. So quickly. I was normal 2 months ago. I mean, 2 years ago. And now I'm like so weird. I don't get it. I mean, getting older sucks. Menopause sucks. Gigi says she's taking 50 milligrams hydroxyzine a day, 50 milligrams nortriptyline a day, doing this for years. Girl, that's a lot. Then you switch to imipramine, then you switch you to hydroxyzine, nortriptyline. You know, there comes a time when you remember the old question is, will I have to take Elmaram for the rest of my life? And Dr. Parsons said, no, you have to figure out if it's helping you or not. So how do you do that? You reduce the dose, gradually reduce the dose. So if you're taking 3 Elmaron a day, take 2 for a week. If your symptoms do not get worse, then maybe it's not helping you. They go to 1 a day. If your symptoms do not get worse, then stop it because the Elmaron might be helping. You might be able to apply that to the hydroxyzine and the nortriptyline. Try taking less. You know, I mean, talk to your doctor about it. Tell them you've got some concerns, that you've been taking this for a long period of time, and ask your doctor what they think about you doing that, especially since um, they are doing a very good job documenting this cognitive decline thing that's going on. You know what? Let me. Marion says, just got the bladder builder from your sister-in-law in the USA. Will I just take it every day or only when I have a flare? No, you take it every day, but start small. Just take 1 capsule, see how you do. Do 1 a day for a week, work your way up. Let me see if I can find the. I know that this crossed my desk in the last 10 days. Let me see if I can find this. Yeah, here it is. The Journal of the American Medical Association. Holy hell, Medscape. Anticholinergic drugs could account for 10% of dementia cases. That's new. That happened 12 hours ago. I had not even seen that. But the Journal of the American Medical Association published yet another study, case control study, anticholinergic drug exposure with the risk of dementia. In this nested case control study of 58,000 patients with a diagnosis of dementia and 225,000 matched control, there were statistically significant associations of dementia risk with exposure to anticholinergic antidepressants, anti-Parkinson disease, antipsychotic drugs, bladder antimuscarinics, and anti-epileptic drugs. The associations observed suggest that these drugs should be prescribed with caution in middle-aged and older adults, although there was a study of younger patients that I saw like 2 years ago. So the conclusion: exposure to several types of strong anticholinergic drugs is associated with an increased risk of dementia. These findings highlight the importance of reducing the exposure to anticholinergic drugs in middle-aged and older people. And they made a specific mention of bladder antimuscarinics. Um, the most common prescribed anticholinergics were antidepressants, anti-vertigo, antiemetic drugs, bladder antimuscarinic drugs. Okay, so hold on a second. I have to go to this table. It's not letting me link it. Come here, come here, come here, come here, come here. Come on, you gotta let me open this link. Okay, here it is. Table 3. And of course, they don't give brand names. Hold on a sec. All right, so let's see what the antimuscarinic bladder drugs: oxybutynin, diturpan, darafenacin, fesoterodine, sulfenacin, tolterodine, trospium. Well, that's just a royal blank show, right? All the oral medications listed in AUA guidelines for IC are pretty much listed as this risk of dementia. All the more reason to explore your supplement options, in my opinion. I mean, obviously, this is about the fact that so many patients are over medicated. And if there's a population of patients massively over medicated, it is people that are in convalescent hospitals and rest homes. Imagine they've got all these patients on all these medications, they've got confusion from the drug itself, the drug combination itself. And so if you have any concerns about that at all, you always bring those concerns to your doctor and say, are there other medications that do the same thing that don't carry the same risk? Okay. That's some scary, I want to swear so bad right now. You know what I mean? It's 4-letter word. That's scary blank. Dominica says, I'm only laughing because the urologist in the ER calls me Dr. Google because I make them sit down as I give them a lecture. So, Dominica, next time, give them a copy of the AUA guidelines. Jana says, I have horrible back pain on my left side pretty much all the time. Okay, so the question is that kidney pain? Is that muscle pain? If it's kidney pain and if it's very, very sharp, you better tell your doctor about that. But if it's pain that happens when you're moving, it might be your psoas muscle. The psoas muscle is a muscle that starts low by your hip bones and goes up both sides. It's a really thick, meaty muscle. And when I get back spasms, it's my psoas muscle. Janet, I wouldn't expect Urabel to help if you've got back pain on your left side. I don't. It wouldn't. Does heat help? I mean, if you touch that spot, does it hurt? Is it a muscle knot? One of the things that you could do is you take a tennis ball and you lean against a wall and you kind of rub. Whoops. You kind of rub around on it. I don't know what that is, hon. And the reality is you don't know what that is either. But I mean, it sounds like it could be a muscle knot, and you got to get that clarified somehow. You cracked your pelvic bone not long before you were diagnosed. Have you had a pelvic floor assessment, my dear? Come on now. That's exactly the type of thing that triggers IC subtype 3 pelvic floor driven. The odds are you've got a pelvic floor muscle injury, including your psoas, which is what is giving you your back pain. Urobell is a total waste of time if that is the case. You need a proper pelvic floor assessment to see what's going on with your muscles. You know what? I'm going to turn on my air conditioner. Let's see if it's too loud. Getting a little hot in here. Can you guys tell me if that sound bothers you at all? If it is, I'll turn it off. We're going to go for about another half hour probably. Alrighty. Gigi, I told my sister I wanted to confront her. My sister said, please don't tell her that I told you this. My brother already told me don't post anything about what I see on your Facebook because friends don't want to see it. Well, I can see both sides. I mean, can't you see both sides? You need a place to vent. You need a place for people who care about you and who love you will support you, and you need a place where other patients understand what you're going through so that you can get the support you deserve. Is a Facebook feed the place to do that? And my argument is absolutely not. You'll never. It's kind of like expecting your husband or your partner to say exactly what you need to say at the end of a long day or the end of a long or at the end of a long night. If they don't have this, they don't have a freaking clue how you feel. They will never be able to say to you exactly what you need them to say to you. This is why you have your IC buddies that you call on the phone, or your IC buddies that you meet online, or you talk privately with on Facebook or other social networking, right? I like the 1,000 cuts on your hand and pouring lemon juice on it. That works. Linda says Lyme disease has caused so many issues. Is there any evidence of IC being caused by Lyme? Yes. Yes. In a small group of patients who were Lyme positive, absolutely. Lyme Borrelia bacteria have been found in the bladder wall, infecting the bladder wall. So there is absolute proof that Lyme patients can have Borrelia infections or Borrelia infections in their bladder, causing their IC symptoms. We just talked about that. This is the cover for our next magazine. It's our spring summer issue. And in my editorial, we talk all about the bacterial theories. The question is, who do you believe? My answer is you can't put all of your eggs in the infection basket because a lot of you have muscle injuries. But for some of you, bacteria can be playing a role. Okay, was that a mosquito bite? See, I don't see how a mosquito could be in here right now. I hate bites with a passion. Dominica says, one thing I found that helps is to make food from scratch. Yeah. Yeah, that's really helpful because you know exactly what's in them. The other thing I'm working on is making shampoo from scratch and making lotion from scratch because I'm really trying to reduce my plastic load. My first thing is going to be making laundry detergent. I want to make my own laundry detergent, and I have a book that's showing me how to do it. It's just like 3 ingredients, super easy. I just am so sick of the thought that how many thousand bottles of laundry detergent that I've purchased will be in a landfill for 10,000 years. I just think that that's so wrong. So I only try to buy laundry detergent that's powdered. But I'm using all right now and I can't find the powder at all. And so I'm back to plastic and I hate it. Oh, I'm so glad you can't hear the air conditioner because it feels good. Hi, Kim. All right, let's go over to YouTube here for a moment. Suzanne, where can you find more information on the acupuncture study in our magazine, which will be out next week? Yeah, okay, so guys, one of the things that I'm hoping you guys can help me with right now is our campaign for IC Awareness Month, which I've got to solidify this weekend or in the next week. We're looking for a theme. We stand together. And so you guys on YouTube, we're having a good discussion over here. You guys are killer. Okay, so here's some ideas. Let's see. Hold on. Donna Townsend, you are amazing, girl. Okay, okay, and Lisa, girl, God, I love you guys. You know, I'm so glad that we're not alone anymore. We get to work on this together. Okay, so Lisa says, how are these for slogans? IC equals incredible courage. IC cultivates incredible courage, or IC fosters incredible courage. I like IC equals incredible courage. We've never done that before. That's pretty cool. Donna thinks that the future of IC is, I think that's really solid too. I see a future and it is bright. You know, I was doing a coaching with somebody last night in Thailand, and what was she wearing? She was wearing this great shirt. I told her I wanted it. She bought it at H&M. Her shirt said, it was a white shirt with just beautiful cursive writing, and it just said "beautiful soul." And I love that, because I think we have to remind ourselves that we are beautiful, and we have to remind other people too that they can be beautiful too, and that all gets down. I don't know, that's corny, but I love that. I would love to have a T-shirt that said something like that. Beautiful. How does the future for IC look? What is our vision? Working together, we can solve anything. The future of IC, vision, bright future, self-healing. Okay. Healing is always happening. Donna says we should focus on urinalysis, subtyping treatment, and holistic healing. You know, I wouldn't mind doing a campaign entirely on holistic approaches. We haven't done that yet. I mean, mainstream medicine is not going to like us for doing that, but when mainstream medicine has our only product causing eye issues, this is when we have to strike out on our own. I mean, I think we could do a campaign that would focus on a natural approach and holistic approaches. Yeah. Hey, Donna Christie over here in YouTube actually helped me run IC Awareness Month for a couple years. She won Poster of the Year and all that sort of stuff. Christy can kick some IC butt, if you know what I mean, in the best possible way. Lisa, I think the critical step is to find the causes, the cause or causes, rather than just subtyping treatments. I don't think subtyping goes far enough to identify cause. Yeah, but that's where research happens. I mean, we're not going to be able to do that. I mean, you have to be here. Hold on a sec. Where is it? Here it is. We can only do different colors. Hey, it's getting dark out, so I'm losing my light fast. I don't know how we could do a campaign that focuses on causes. Interesting to think about. Very, very interesting to think about. Christy, pelvic floor therapy finally stopped helping you? Oh no. Christy, girl, we got to have a talk. I have not talked with you in like over a year or two. I'd love to hear how you're doing. Elise says, "What should I search for to find the opiate protocol?" You know what? I was looking for that. I was hoping to look for that today, and I just didn't have time. I will try to find it and post it for you. It was a CDC revision of the opiate guidelines with respect to the chronic pain patient, and it happened like 3 weeks ago. Linda says the dementia concern. Yeah, yeah. I mean, in the end, guys, when we talk about the causes, when we talk about the causes of bladder dysfunction and bowel dysfunction, so much of it gets back to uh, our environment and the foods that we're eating and the chemicals that we're being exposed to. And I think the single most important thing that all of us can do is try to remove as many toxins from our daily life in our food and in our environment. Eating organic whenever you can, using the environmental working group lists of the Dirty Dozen and the Clean 15, so that like I never buy non-organic strawberries. Strawberries have, and same thing with potatoes. Pound for pound, potatoes have the most pesticide residue in their meat than I think any other vegetable. So when you go and you get those French fries from McDonald's, you're getting non-organic French fries filled with pesticides. And for that matter, I mean the whole thing with Roundup, and there was just new testing with all the oatmeal bars and how massively they're contaminated with Roundup, and just the oatmeal you give your kids in the morning. Man, we got to clean stuff up here because big business is messing with our health and messing with our environment so badly. If I were a betting girl, and I am a bit of a betting girl on this, I think that in the end, we're going to come back to the concept of toxic contaminants triggering a lot of this. We got superficial injury, that's real, but I think toxic contaminants in our food, high acids in our food, all that other stuff is absolutely playing a role too. I see a future. I see a future with hope and glory. I like that. I see a future. I see a future. I think we can work with that. That's not bad, hun. I see a future. I see a future. The question is would you get a t-shirt that said that? I'm actually thinking about doing car clings. I see a future. I mean, I like, ooh, Manda. That's pretty interesting because then we can tie all sorts of stuff into that. Manda Ashley, girl, you may just have given us the campaign for this year. Let me think about it and play with it. Dominica, quit using cleaners like Clorox, use baking soda and vinegar. What do you wash your clothes in, Dominica? Be curious. I mean, yeah. All right, guys. Well, listen, as you can see, it's getting dark. And my light is disappearing even with a light here. If I didn't have my light here, it'd be much worse. So I think that it is time to call it, and I'm going to go. Donna, you like that one? I see a future. Hey, that's pretty good. I gotta say, that's pretty good. What do you guys think of that? I see a future. Manda, that's really, really good. Okay, well, I'm going to think about it. I mean, I'm the chairperson of the awareness campaign, mostly because guys, anybody wants to help with IC Awareness Month, please email me. All right, and for those of you who stuck around this long, don't you think it's time for a giveaway? Let us end the night with a giveaway. How does that sound? The question is, what should we give away? Isn't that a good question? Donna, go for it. Play with it. Play with the concept with that. All right, so let's look here. What do we have here that we can give away? All right. I've got jam, low acid jam. I've got bladder rest. I've got basis soap. Regular girl probiotic fiber. I only have one of those. What else do I have? Well, let me take a moment here. Pre-Leaf sponsors all of our IC awareness meetings. I forgot to introduce them at the beginning. Thank you, Pre-Leaf, for underwriting these live events. It's much, much, much appreciated. Pre-Leaf reduces the acid in the food that you're going to eat. So if you're going to go to grandma's house and eat some lasagna, and you know lasagna is going to kill your Hunner's lesions, take a couple of Pre-Leaf beforehand. That will reduce the acid load, and maybe, just maybe, you won't have quite the wicked flare. Alrighty? Okay, so let us give a bottle of Bladder Rest as our freebie, the new supplement. All right? So, hold on a sec. Hold on. And you know what? It's not Manda Ashley, my dear, for coming up with I See a Future. I would like to send you a bladder rest. What do you think, hun? Would you take it? I don't mean, I'm not asking you to take the medication. Would you accept this as our gift for coming up with this? Oh, and look at that. Your front would say, I see a future with hope and glory. And on the back would say, just listen to my story. Girl, gosh, that's pretty good. I got to put that back. Just listen. Oh my God, I love that. All right, so Manda, would you please send me a private message on Facebook? If you're my friend, I'm Jill Heidi Osborne, or you can send me email icnetwork@mac.com. If you could reach out to me by email, I would love to send you this as a thank you. Your choice, but if you would prefer not to get it, that's okay. We'll come up with something else. All right. Wiener chicken dinner. I think that's pretty damn good. All right, my friends. So Amanda, I'm going to put this bottle to the side with your name on it. I think your concept is really, really good. We'll give you full credit for it, of course. But I might change it slightly. No promises. But I think it's a really, really good start. And so we're going to play with it a little bit. You know, IC Awareness Month is always a group effort. I always have to try to make it work with the press and all that sort of stuff. So I have to think about it a little bit, but I think it's very, very promising. All right. This is your bottle. It has your name on it. Send me an email, icnetwork@mac.com. All right, my friends, this means that I have been broadcasting a total of 6 hours today. Yeah. It's been a good day. been a very, very good day. I wish you all a wonderful weekend. Get out in the sunshine. Have a wonderful day. If it's too hot, stay inside, read a good book, use some air conditioning, drink your icy friendly beverages. Go on over to icdietproject.com. We've got some really good recipes for bladder friendly Italian sodas, bladder friendly sun teas, bladder friendly spa waters at icdietproject.com that you can use for this hot weather. All right. Okay, my friends, I will talk to you later. And Donna, let's talk. Christy, let's talk. All right, see you later. Goodbye, YouTube.